Hey class, it's Mina Love. It's time again for another lecture, and we are now in chapter 11, our phlebotomy lecture on capillary or dermal specimens. Here's your chapter objectives. You guys can read those. Today we're going to talk about, though, the indications for skin punctures. An indication for skin puncture is a good blood sample source for adults and pediatric patients when you only need a small amount of blood for the lab test. And when compared to getting a venipuncture, dermals cause less risk for an accidental Sharps injury, causes reduced risk for injuring adult patients because it's less invasive, so you are not likely to cause any nerve damage. And it's perceived to be less painful than a venipuncture by many people. It's faster. It's easier for self-monitoring, for example, with your diabetic patients. And it also costs less in terms of equipment and supplies. Who's likely to get a skin puncture when the lab only needs a small specimen? Your patients with severe burns on the arm, or as you can see in the illustration, if they have some other type of access device, such as your dialysis patients, obese patients, patients with thrombolytic tendencies, your geriatric patients with fragile or inaccessible veins, patients who have severe needle anxiety, those patients who we need to save their veins for other therapies, such as the cancer patients, those patients who get point of care testing, and those patients who can perform their own self-testing. So when do you not want to use a skin puncture? You don't want to use a skin puncture when there's a larger amount of blood needed for the blood test, or when the patient has swollen fingers, which causes fluid to get between the tissues, and that can dilute your blood specimen. If that patient's dehydrated, or if they have poor peripheral circulation. Okay, we're going to stop there today, and your assignment is going to be to make a list of when to use and when not to use a capillary blood sample. Submit a picture when you're done, and for these you can see box 11-1 in your text. And after you complete your assignment, you can do this. And I will see you guys next lecture. Bye-bye.